Experts saying Indiana is still seeing a surge of COVID-19 cases due to the Delta variant, with the vast majority of cases and hospitalizations being those who were not vaccinated. But they predict cases may peak within the next week. Dr. Christopher Doering, Vice President of Medical Affairs for Franciscan Health, joining me now to talk about the very latest developments of the pandemic. First off, good morning to you, Doctor.
Hey, good morning, Scott. Good to be with you.
All right, let's go ahead and talk about the peak. Do you think it is going to possibly, peak in the next week, or is it too soon to even tell?
Yeah, that's a good question. We've certainly been following the numbers, following the data really closely during this current surge. It does appear that in most parts of Indiana right now, we're either hitting a peak or maybe starting to come down a little bit off the peak. So good news on that front.
Other good news, possibly, Pfizer announcing its vaccine for children ages 5 to 11. It is safe, and they will ask for approval soon. So I know so many parents, and obviously the kids, they have absolutely no choice right now. They cannot take it. Do you see, if they will be able to take that will have a big impact on the rising cases?
Well, it certainly presents the opportunity, and as kids have been back in school, we've seen a lot of these numbers surge, and so certainly for that school age group, 5 to 11, the fact that we will hopefully soon have access to that vaccine should start to drive those numbers down, and hopefully, that'll coincide with the Delta variant fading down as well.
What about booster shots? We've just read stories. Recent J&J just did research saying its booster shots have basically upped the effectiveness of their vaccine from 80 to 94%. But a lot of people are still questioning when and where do you get the booster shots, because I know the Biden administration wanted to do it, I think, just a couple days ago. Obviously, that did not happen.
Yeah, they had gotten out in front of that a little bit before the data had been reviewed. It looks like all the vaccines still protect very well against severe disease, hospitalizations, and death, but you definitely do see waning immunity and more breakthrough cases amongst the vaccinated, probably in that 6-month time frame or so. So it is good news to see the J&J booster studies are positive. We're also getting positive data from the other 2 vaccines, Pfizer and Moderna, on the boosting effect as well.
Yeah, what are you thinking in terms of timelines for the booster shot? Because I know they said, hey, 65 and older, at least the advisory panel said that was unanimous. They recommended that.
Yeah, so I think you'll be hearing something probably as soon as this week about the high-risk populations, which might very well include healthcare workers and other first responders. But certainly that over 65 group is likely to be approved in the next week or so.
Final question, Doctor. A lot of people are saying this just might turn into something that does not go away, but will hopefully end up being manageable. We have, just in this country alone, 70 million Americans who've not taken the vaccine who are eligible. Do you see this as something that's manageable, or even too soon to tell?
Well, I mean, it's in our hands, right? And so the point that so many haven't taken the vaccine that are resistant to it at this point, certainly I hope as these vaccines get full FDA approval, as more data around safety and efficacy continue to come out, those millions will eventually decide to get vaccinated, joining the rest of us, and turn this from a deadly pandemic to a more nuisance, respiratory infection that doesn't have nearly the same effect on death and disability.
Let's hope so. Dr. Christopher Doering, thank you again for being here. Great information. We do appreciate it.
Good to be with you, Scott. Have a great day.